So, good morning, everybody. Today's 256 days into this, 37 weeks since our first case back on March 12th. We now have 5,047 positive cases of COVID-19 in Albany County to date. 2,081 people are currently under mandatory quarantine. Today's average is 97 positive new cases overnight. Yesterday we had 112. Then we're in the 60s, 97 positive new cases overnight. We had 1,493 new positive cases since November 1st. That's over 29.5% of the total positive cases since the outbreak. We are in a second wave. It's getting worse as we go on into the month of November, and what's scaring us, quite honestly, is Thanksgiving's right around the corner. Over the positives, of all the positives, the patients interviewed yesterday, we know that we had 9 had close contact with a positive case, and 88 didn't have a clear source of infection. Meaning, it could be a variety of things. 1, they said they didn't have any contact, and 2, we didn't get all the information from them at this point in time. But still, again, it's alarming the amount of people that just continue to say they don't know how they were exposed or not telling us where they're at. It only helps us to help you to curve this. If you don't want to get into the yellow zone and you don't want to get into more shutdowns, and if you want to support your local businesses, please do the right thing. Just let us know so we can stop the spread, and that's what we're trying to do. And we can't stop the spread without you telling us. I keep telling you, our contact investigators are just there to get your information. That's it. They're not going to prosecute you. They're not going to turn you over to the police department. It just helps them do their job. So keep that in mind, too, as we continue to go forward. I know people are stressed, and I know as they continue to go out into public, you do tend to forget where you're going. Sometimes you go for a walk, sometimes you go for a drive, sometimes you just stop into a store you weren't thinking about. These are things that we just need to know, again, so we can do our job to continue to go forward. All the information you give us is in confidence. We're not going to, it's confidential, I should say. We're not going to tell anybody. And again, it helps us to say things like when we had the 99 restaurant, to put that information out there to let people know if they were at that restaurant at certain times, someone had, a positive case. Tipsy Moose, I think it is, on New Scotland Avenue. Same thing. It just helps us get out to the public that, hey, if you're there, please, if you have signs or symptoms, or if you're worried, call our health department or go get tested. If you have signs and symptoms, go get tested. If you're just worried, call our health department, and we'll tell you what to do. So these are things we want you to remember as you go forward, and allow us to identify the potential clusters or hotspots to stop the spread of this virus. As of today, 743 people have now completed quarantine. Of those, 4,208 tested positive for the virus. That's an increase of 84 recoveries since yesterday. There are currently 41 people in the hospital. That's down 4 from yesterday, which is good. And our hospitalization rate is 0.81% of those who have tested positive. Yesterday, that rate was 0.90%, which is also good. That's going down. There's currently 11 patients in the ICU. Yesterday it was 12, so we're down 1, which is good. And over the last 5 days, there's been an average of 97.2 new positive cases each day. Yesterday it was 89.8. That's not so good as we continue to move forward. Yesterday we talked about Albany County's percent positive rate. Since this will decide whether or not we enter a yellow microcluster zone, which requires a 7-day average of 3% over a 10-day period. Our 7-day percent positive average, based on New York Forward's dashboard, county by county, today is 3.1%. So we're there. And we have to stay in that, though, for the next 10 days in order to go into the yellow zone. So I'm saying to everyone out there, please, if you don't want to shut down, you don't want to go back to having the governor put orders out there that, hey, look, we're shutting down, we're not allowing businesses open, gyms are going to close again, restaurants are going to close. And we work so hard together as New Yorkers to get everything back open, to do the right thing as we go forward. Help us. Because we're there. If these numbers continue to go up, we're going to hit that yellow zone. And when we hit that yellow zone, I don't want to have to tell businesses in them areas, hey, look, you have to shut down now. When they're just barely making it, or gyms, or whatever the restaurant or business might be in that area, we don't want to do that. Or, you look around what's going around this country. I mean, California's doing a lockdown from 10 p.m. to 5 a.m. every day now, telling people you're staying home, off the streets, stay out, do the right thing because of the spread. And you're seeing more and more states around this nation do that. And I want to commend Governor Cuomo for his leadership. Whether you agree with him or disagree with him or like to scream at him, he is trying to lead us through this difficult times that we're in. But we need to be in this together as New Yorkers, and we'll get through it if we continue to try to do the right thing. So one of the things I do want to explain is that AAA, who just came out with an article, basically said that this is the lowest record travel they're seeing for people, airline travel. I think last year it was like 4.5 million. They're estimating 2.2. But that's still 2.2 million people traveling to go see their loved ones, traveling to go around, going to hot spots, going to other areas, clusters, and then coming home. And I know you want to do the right thing. You want to see your loved one. I've said this and I'll say it again. It's just a turkey. Hold off 4 or 5 months from now. Do it then. You want to get together with your family? Wait till the springtime, and it's nice, and the vaccine's out, and everyone's getting vaccinated, and you can gather and really enjoy that Thanksgiving meal versus being scared. And I know people want to see their loved ones. I know they want to sit there and hold their mother or their sisters or their brothers or their loved one. You can do that in time, but by continuing to do the right thing in the state, and I'm begging you, by doing the right thing, we can get out of this. But we're not going to get out of this if you just get COVID-19 fatigue and you decide, hey, I'm done and I'm not going to do this anymore. People are getting sick, and I know I identified that age group 20 to 29 early on, and you know what? I'm not happy that I was correct. I'm not. But these kids are infected, and they're giving it to people, and they're keeping it spread. We need you to do the right thing. We need everyone to do the right thing, and we'll get through it. But yesterday, my deputy Dan Lynch explained about the average, that we dropped below 3% in a 10-day count, reset, and the count would start again once our 7-day rolling average hits 3%. Dan's here to talk about that if there's any questions. So that's the thing we got to continue to watch. And I know we've had questions from the media. I've had questions from Facebook on the micro cluster, how it works, and everything else. That's why we've been going through it. And I have people, not just our health department, my policy analyst in my office, and Dan and myself, looking at it to make sure we get the right information to give out. It's what we bring up in the control room to General Murphy and Joe Rubito and everyone on that phone call. I can't thank you enough for everything you're doing for the leadership as we move forward, because again, we're in this together. I did mention about the 99. If you're there at the 99 restaurant on November the 15th between 10:30 and 9:30 p.m., or at the Tipsy Moose on New Scotland Avenue in Albany on November 10th, or November 11th from 5 p.m. to midnight, you may have been exposed to COVID-19 by a staffer at either of those locations. Like I said, if you have signs or symptoms, please reach out and go get tested. We keep urging everyone to follow the guidelines and assume that everyone you come into contact may have COVID-19 positive. Again, we know it's a sacrifice to ask you to stay at home as much as possible, but you will limit your exposures and may help prevent people from getting sick and possibly dying. I don't know how many times we have to say that. if you do the right thing, you could be saving someone's life. So please continue to do it. I do want to thank you to everyone who's already making these sacrifices. I know there's a lot of people doing the right thing, staying home. I know there's a lot of people that haven't gone out. I mentioned yesterday how people haven't seen their parents. It's crushing them. It's crushing them. I get it. And, it's tough. But we can do this working together, getting through it. So please, I'm urging you to all go out less these next couple of weeks as we're at this peak to help us keep our numbers down so we don't go into the yellow zone. Avoid large gatherings. Wear a mask out in public, socially distance, and cough and sneeze into your elbow and stay 6 feet apart. It's not a lot. We're almost there. The light's at the end of the tunnel. We're almost there. We'll get through this if we continue to do the right thing. We can't let a certain percentage of bad behavior hold us up. And again, as you walk down your street and you want to go for a walk to clear your head, you see these mom and pops businesses that won't be there next year if we continue to stay shut down, if we continue not to get them back. It's tough. When I was talking to Tess at McGarry's, just to see on her face, you can see the pain that she has trying to keep people working, trying to help them pay their rent or put food on their table, and do it in a safe way and reinvent herself every day. I can't imagine that, the stress that these owners are going through, or the stress of gym owners who finally just got opened up that may be shut down if we go into a yellow zone. So again, of course, please go out and get tested, even if it's just a cough or a sneeze, or even if you don't have any symptoms, please just go out and get tested. And it will help us to continue to identify the clusters where they are and help us do our job. I want to remind residents that our new map feature on Albany County website can make it easier than ever before to locate different testing sites. So please, it gives you the wait times, it gives you the numbers. It's very easy. Go there and make your appointment. Albany and Whitney Young, as always, if you don't have insurance, we pay for it. I know we were getting a lot of comments about the other sites. We've been Dan and I and my staff, we've been trying to work with them to try to figure it out, because we want, A, for people to have convenience, B, if they don't have insurance, to make sure we cover it. So please, Whitney Young, if you don't have insurance, we pay for it. And the state of New York, under Governor Cuomo's leadership, has not charged anyone in the state. So keep that in mind. And again, go to our website. But you can go to the University of Albany. Number, as always, for appointment, 1-888-364-3065. Or Whitney Young. You can go to the Whitney Young website, or you can call them at 518-465-4771. And, please go out and get tested. There's a lot of places to get the antibody testing. I know I got some questions from parents about kids that got exposed, that, we set it up with Albany High and with Cornell Cooperative Extension to work with the school districts, and we're expanding that throughout the county, and we got to work on it. We just rolled it out, so there's going to be some bumps in the roads, and I know some parents are eager to get their kids tested to make sure. But remember, that's just a snapshot. You can get tested, and you can unfortunately walk out someplace in 4 hours be exposed. So it doesn't mean that you're not going to get it. Doesn't mean that you're good to go to continue doing things. Continue to do the right habits, not the bad habits, and we'll get through it. But Dan, I don't know if you want to talk about the microcluster or anything like that.
Sure, County Executive. Real briefly, yesterday we talked about the 7-day rolling average being 2.9%. Yesterday's infection rate was 4.6%, I believe, bringing our 7-day rolling average to 3.1. So that's the quantifying number that we need to get into the window that I talked about yesterday, that 10-day window of positives above the 3.0%. So today would be day one. Hopefully, with continued testing and folks doing the right thing, we can bring that overall infection rate below 3% and reset the count. But we have qualified, and now we're in day one, and we'll see where the numbers go. But we ask again for your continued attention to following the guidelines, and hopefully we're able to report in the near future that we are under that 3.5% 3.0%, and we can reset that count.
Thank you, Dan. And to remember, everyone, when you're in quarantine, it is for a certain period of time. The health department will let you know. So the person you know who I'm talking to, and I don't want to call you out, you're there for another week, buddy. So suck it up and get used to it, and do the right thing. I know it's tough, especially for kids that are young when their school notifies them and tells them, hey, look, you might have had exposure, you got to stay in for 14 days. If you take anything from this, and I don't want to call my person out, learn from it and understand why it's important to do the right things and stay home. And I know it's hard for young kids at that age to understand, well, I don't feel sick, my friends aren't getting sick, why do I got to stay home? I know it's tough. But please do the right thing. Switching gears a little bit, we talked about yesterday the adoptive family, the drop-off or unwrapped gifts yesterday at Crossgates at True Hotel. So I want to thank everyone that did that, and the Times Union for stopping by, and Jim Franco for what you did, taking the nice picture. So thank you to everyone. It's going to make a difference in someone's life. So to the Commissioner Maura Manning and Deputy Commissioner Nicole Ward, thank you for getting out there and socially distancing and doing the right thing, but getting these presents that are going to help these families. And we had, I think, over 460 kids last year that we gave to, and there's going to be more this year. So to Toys for Tot and everyone else out there doing this for kids, thank you for making a difference in their lives. But you can still go to the albanycounty.com to our Department for Children, Youth, and Family page where there's adoptive family information, and if you need a gift, because I've had people reach out, you can also go there and register your family, and we'll do our best to make sure that you get something on Christmas. So again, remember mental health. If you have an issue, for children especially, for adults, please call 7 days a week, 518-269-6634. So our psychiatrists can handle adults and children, but they may refer you to someone else, just depending on what your child's issue is going on. I'll actually have probably Dr. G come in and talk about it this week. It's important. This is really affecting kids. It's really affecting them, and it's tough on them. They don't understand what's going on out there. So our 24-hour sexual assault hotline number is always 518-447-7716. Our 211 in our New York State hotline number, as always. And one of the other questions we get is that a couple of people ask, are we going to do these briefings every day? It's a tough call. We make a decision at nighttime, and it's tough when you go from 147 to 112 to 97 to 96 to the 60s, and you're like, well, it's 60. You start to get numb over numbers, and you're like, well, it's not as bad. And I don't want to sound like a broken record, but the reality is we're here. It's wave 2, and I think it's people that are doing the right thing. Thank you. The people that aren't, please, if this doesn't wake you up, I don't know what will. And go on the internet, look at stories of young kids, and they just did one on a 19-year-old girl, college kid, who got infected, and her lungs won't be the same for a long time. I just saw in Texas how a 5-year-old lost his mother and father, both in their 20s, will have their first Christmas without their parents. I'm not trying to scare you, but we had a record number of over 1 million people come back positive in the last week alone, and hospitals are filling up, not just here across this great nation, but here in New York State too. They're starting to fill up again. So please help us help the hospitals and the nurses and doctors that are on the front line doing this day in, day out. Help us keep them safe. Thank you.